Welcome. My name is Jason Helgerson. I'm the New York State Medicaid Director, and I'm pleased to present the latest in our New York State DSRIP Whiteboard Series. Today's topic, looking ahead to 2017. So 2016 has been a really important year in the DSRIP program. Lots have been done, and we have a lot to look back and be proud of. 25 organizations, performing provider systems have been launched, and they've built some very important infrastructure. Early look at the data suggests that they're actually achieving some of the important goals we set out for them, in particular, reductions in avoidable hospital use. That work continues and much to do in the years to come. But we feel, looking back, that 2016 has been a good year in DSRIP and does position ourselves in the 25 PPSs and all the network partners who participate in this initiative, positions us very well for the future. Where are we at today? Right now, we're in the midst of the Midpoint Assessment. This is our opportunity at the middle of this initiative to look at where we stand and make sure that all 25 PPSs are in a position for success. The independent assessor has done their initial review and released their initial findings. And the good news is that they find that all 25 PPSs overall are on a path to success. They did, however, find that there are deficiencies, there are issues that at least 21 of the 25 need to address. And so we look forward to working with the PPSs, continuing to gain feedback from the community between now and the end of March, when we hope to have whatever changes, structural changes are needed in place so that all 25 PPSs are on a very good path to success within this important effort. Next up, value-based payment. Continues to move forward, major structural change in the program, in some ways, bigger structural change than even what DSRIP has to offer. What value-based payment really is about is better alignment of the incentives within the healthcare delivery system, trying to reward providers when they work together successfully to improve health outcomes for the Medicaid population. Much is going on. In fact, we hear about every day more and more providers and plans working on new, innovative ways to move forward the VBP agenda. We have some pilots that we're finalizing to help launch, but no need for folks to wait for those. We encourage providers and plans to look at these. We've had boot camps all across the state. Information is available, and we will look throughout 2017 to support providers and plans in their efforts to move to VBP. And then lastly, proceed with fact-based optimism. This work is extremely difficult and challenging. No state, almost no region across the world is engaged in such a large-scale effort to transform healthcare. Thousands of organizations, millions of people impacted by the work that you are all doing within the 25 PPSs. While we applaud you for your effort, we encourage you to continue to work hard to bring together your organizations to connect better with Medicaid members and proceed with this sense that what you're trying to do is in fact possible. As we've said in the past, when pessimism becomes the norm, it becomes very difficult to get your organization, the organizations you're working with, to continue to stay motivated and working towards what are very ambitious goals. So we asked, please keep working in this fact-based optimistic way, and we think if we can keep that as our mantra moving forward, collectively we can be successful. So that's it. Hope you enjoyed this. We'll be coming out with more whiteboards in the future, but look forward to our continued dialogue on this important initiative as we work to transform healthcare for the 6+ million people on the Medicaid program. Thank you.